Our first panel today is going to be some great friends. Craig Manassian, who's Chief Content Officer, Communications and Marketing Officer at the Clinton Foundation, a tremendous background in strategic comms, public affairs, programming and content development, and does a tremendous amount of work to advance the impact of the Clinton Foundation and the Clinton Global Initiative. Craig, thank you so much. Why don't you join us up here? We are also going to be with Catherine Chen. She is the CEO of the Asian American Federation. Catherine is the Chief Executive Officer, and Asian American Federation is New York's leading advocacy voice for AAPI Power, a seasoned nonprofit and movement leader with a deep commitment to equity and justice. Before that, she was CEO of Polaris, a national anti-trafficking organization in Washington, D.C., previously worked in philanthropy as a migrant rights funder at Humanity United, and ran a project for the U.S. Justice Department to ensure trafficking survivors receive relevant services. She grew up in California, watching Chinese uncles and aunties in her community fight for their rights. She has a bachelor's degree from Stanford and a master's degree in public health from this great institution in Columbia University. Catherine, thank you for joining us. And Gary could not join us today, but Ravi Dahiya from YAI is with us. He led a portfolio of home and community-based services and returned to YAI in 2016 after a decade of work at Innovative Resources for Independence, where he served as Associate Executive Director for Program Operations and Quality Improvement. His career in intellectual and developmental disability support began when he became a direct support professional while completing college. Since then, he's acquired 25 years of increasingly senior experience managing every kind of intellectual and development disability support throughout his work. So Ravi, it's a pleasure to have you with us today. Dr. Vassan, if you'd like to join us as well, we could start the conversation. Now, Catherine, I know you have a report that you wanted, or a fact sheet that you wanted to share. But first and foremost, for everybody, as you start to answer these questions, just tell us how it's rooted in your work and what you do. So how does your model, the Federation model, how are you dealing with what's happening today with these concerns that Dr. Vassan laid out and Dr. Dasgupta laid out? In a Federation model, how do you engage the work?
Thank you so much, Basil. It's great to be here. It's weird to be in like brand new buildings at Columbia because I left 22 years ago. So anyway, it's really exciting to be here. Thank you for the conversation this morning. The Asian American Federation, we're about 36 years old. We are a leadership organization. So the way that we work is we really deeply work with about 86 different frontline Asian-led, Asian-serving organizations all up and down the state to understand the complexities of what's going on at the very ground level, the last mile level. So our organizations are folks who are refugees who are leading other refugees and volunteer efforts for the Karen community upstate, or we are some of the largest and most historically known organizations serving Chinese Americans in Chinatown, right? So we're a very broad organization, and the way that we work is really to understand deeply what's happening on the ground and march it into the halls of power and make sure that our elected officials and our leaders are answering the needs of our community.
And you have a fact sheet that you wanted to share with us as well.
Yeah, and I see the slide deck up here. What I wanted to do is actually just go very quickly into some of the grounding of what Ashwin and Sayatani were saying about like what is actually happening in one example of a community here in New York. If you go to the next slide, I'll just do that really quickly. I don't know how we advance things.
We'll get that.
And if not, I can actually just go without it.
Yeah, and Andy will check on that for us.
Okay, I'm going to just, for the sake of time, just kind of keep going. The community that, okay, perfect. Asian Americans, here in New York City, we're about 1.5 million people, about 17 to 18% of the population. And I guarantee you that most people do not know that. We are made up of more than 20 different ethnicities. We speak at least 36 languages here in New York City alone. And about 70% of our community is foreign-born. I think the things that people don't really realize, at least 1 in 4 live in poverty. If you compare sort of near and at poverty, it's about 34% of us. And 48% of our community has limited English proficiency. So when we're talking about these policies that are starting to change, I'm going to talk a little bit about how some of those policies are impacting us. Really understanding how complex the community is, that Asian as a label is convenient for understanding a community, sort of, but in reality, what we're talking about is that the Asian community is a very diverse and very complex community. I can go through this? Okay, go ahead to the next. Sorry, I don't know. I'm like trying to figure out who's controlling.
I can do it. I have the
you
power.
have the control. Very good. Very good. One of the questions that has come up a lot, right? What is actually happening to Asian New Yorkers as all of these federal health policy changes are happening? And I do want to just remind folks of a little bit of this grounding. About 640,000 Asian New Yorkers statewide rely on Medicaid, CHIP, or other forms of government assistance, right? So this work, we shorthand as HR1, or people call OBBA, or whatever the thing is, but the big spending bill that really kind of, thank you, drove a dagger into our community is going to have very, very large impacts on the Asian community here. We're expecting about 1.5 million New Yorkers to lose health coverage in the next 10 years, but like I said, 34% of the Asian community lives near or at poverty, and a vast majority of those folks are on Medicaid. So these are folks that are experiencing these kinds of changes in very unique and challenging ways. I'm going to just go into that for a second. So with the recent government shutdown, of course, what we saw with SNAP were widespread panic in our community. 40% of low-income Asians are on SNAP here in New York. And one of the things that's really important about that impact in our community, there are less than 10 culturally competent food pantries in New York, serving at least 500,000 Asians who need food. Right, so there are lots of food pantries, there are lots of services for food in the city, but when you actually, I can count, I think there's 7 right now, organizations across the city that can actually provide food that our community understands, knows what to do with, would eat. And so these are huge gaps in the kinds of services, in the kinds of felt and met need that are happening for our community right now. And then the one other thing that I do want to highlight, which I think Dr. Vasan also talked about, was what is going to happen to the healthcare sector itself, right? 17% of Asian Americans in the state work in the healthcare sector. What that translates into is, because there is limited English proficiency, because there are cultural gaps in what people understand about Western medicine, a lot of those Asian healthcare workers actually end up being a bridge to communities that need to trust that a healthcare system is here for them. And when we have widespread cuts that are coming in the next 1.5 to 2 years, we are fully anticipating that not only is there a health impact, there is an economic impact on our community as well, as healthcare workers lose their jobs or as community health centers shut down.
Well, why don't we do this? Let me talk a little bit about, or ask Craig here, because you're seeing things also from a global perspective. Like, could you talk a bit about, and we started this earlier, like what are some of the challenges that you're seeing through the Clinton Foundation CDI in terms of giving and potential partnerships?
Sure, and thank you for having me here today. For those of you who don't know, the Clinton Global Initiative was started in 2005 because President Clinton would go to other very well-respected thought leader conferences and thought there were a lot of really great ideas being presented, talked about, and solutions being offered, and then nobody was asked to do anything with those solutions. So he decided to start one where action was a core requirement of participation, and the idea that government, philanthropy, and the corporate sector could all work together. So one of the trends we're seeing right now is, unfortunately, government, at least at the federal government level, seems less interested. There is a lot of caution, I would say, in the corporate sector about being public about their responsibility work. That doesn't mean it's not happening. It means they're sort of less interested in going on stage and talking about it. And so we have essentially, at least with the Clinton Global Initiative, a three-legged stool where we have one leg working well at the moment. So a trend that we're seeing through that work is what one of my colleagues calls, we are now unsolving problems that had been solved. And you heard a little bit about this before with infectious disease. Polio, the fact that even there's one case that emerged is unthinkable. The fact that, measles is coming back are just two of hundreds of examples of things that we had addressed. And now, we've taken our foot off the accelerator and now they're back. Now, there are also some positive trends that we see. Collaboration, a desire to reform health systems, particularly in low and middle income countries to be more self-sufficient. That requires quite a bit of investment in different ways than foreign government aid. We talk about affordability a lot here, but to build a health system, you have to have domestic manufacturing, you have to have access to the interventions, they have to be at a cost that those countries can afford, and so there's more of a recognition of that. There's more interest in collaboration and partnership from the private sector, certainly, from big philanthropy working together, and I can go through some of those examples. And another trend that we're seeing is the idea that we have to invest in proven solutions right now, because we may not be able to make some of the advances that we had been historically making, but we certainly shouldn't backslide. And so propping up the solutions that are working and leading to good health outcomes is a place where big philanthropy is certainly turning their attention and collaborating with others to do it. So those are a few of the trends we're seeing.
But even so, what I would want to ask, because as you talk about big philanthropy, you don't see them, at least in your interaction, shying away as much as maybe we think they might, given maybe there's a chilling effect that may create a situation where they're not inclined to give in the ways that they used to?
I don't think big philanthropy has not been affected as much. I do think that they're reprioritizing. The Gates Foundation, notably said they are going to accelerate spending down their endowment, but they are going to refine their focus areas of that spending for proven health interventions. So I think you're seeing more of that than walking away from it. Certainly every organization represented here, every organization that's in this field at all is probably proceeding with more caution than they would have been before, but certainly we're not seeing people walking away from the problems.
And Ravi, I'd just turn to you. With the populations that you work with, and you're on the ground, you're going into homes and so on, working with families. There's been some conversation at the federal level, not conversation, but also action in terms of cutting resources to programs that target young people and adults with special needs, and how that potentially even impacts what's happening in schools. So talk about the effects on at your organization.
So we work with a couple of, we have a couple of schools, one with kids with traumatic brain injury and one with kids who have special needs, a lot of them with autism. Both these schools have students who the Department of Ed in New York City cannot support. That's why they come to us. Anytime there is any concern which families see, and many of the families are coming from neighborhoods and places where they are being impacted, as Dr. Vasan spoke about in New York City itself. When there's uncertainty there, we see a drop-off in kids coming to our schools. the anxiety which spreads there translates into kids who, as it is, have limited ability to process and manage many of those emotional disorders. They come to us. We see a drop-off in their performance. We see a drop-off in attendance. So it translates into our schools that way. Now, we also work with a lot of kids who are in neighborhoods, have mental health challenges. So one of our primary programs, which has been growing a lot after COVID, after everybody realized that people with intellectual disabilities also have mental health challenges. Before that, everything was, any medical practitioner you went to said, oh, that's because of an intellectual disability. And one of the things everybody's realizing is, no, they do have lives, emotional lives, which need to be nurtured and strengthened. So thankfully, after COVID, a lot of, including New York City and other states, have really started talking about the mental health challenges which people with intellectual disabilities have. And we've been working with families. As these kids sometimes end up in the emergency rooms and hospitals, some of the programs that the states have been investing in have really, they call us, and we then start working with the families themselves. Some of those programs, the rates have been not increasing. They've been, in some cases, being threatened because of all the cuts which are happening. It does limit us on the ability for hiring people who are qualified. And if we don't invest in those programs, those kids then show up in the more high-cost institutional settings, which are, and we work in 3 different states, so that's where they show up, in the hospitals, in different institutions which unfortunately still exist. I don't know if everybody knows about Willowbrook, but I guess I'm pausing because Willowbrook, as the institution which really caused the big deinstitutionalization movement in New York itself, some of those still exist. And we work in New Jersey, which has some of the highest incidence of people in institutions as it is. So that's where they show up. They cost the state 5 times more than what it would be that we would be able to support them with their families. So these are the programs which states started investing in. It's turned into a flat line at this point, and it is something which we've got to grapple with to really show the investment that the states made should not be turned back.
Now, and this is going to be a question for all of you, but I'd like for you to start. One of the things that I was reading about the organization is the work that you do at the intersection of climate, disability, and caregiving. Could you talk a bit about that? And for each of you in your work, how might climate change be impacting, if at all, your work?
So we actually did a symposium around a year ago, bringing together people from state government, from New York City, and disability providers to talk about exactly this particular issue. Because as we discuss climate change, well, first, the first thought which goes to is, in disasters, where are people with disabilities left? And we had actually people who have intellectual disabilities who we support, who live on their own in many cases with minimal support from us. And the anxiety it causes them is, is somebody going to come and get me? How am I going to get out? And I have worked with there is the Office of Emergency Preparedness in New York City itself. It is a challenge for them because that is not where their particular focus is. People with mental health, especially who do have concerns about government overreach in their lives, are typically not going to respond very easily when government comes calling around. There's going to be a climate emergency. The distrust of government which exists, which causes them to stay where they are, and then many a time they are the ones who are the most impacted. We've seen that in many places. We've talked about how do we mitigate some of those impacts. How can Medicaid be transportable across state lines? Medicaid is a very state-run program. How can that, if somebody's in New York and now suddenly has to go to New Jersey, will New Jersey Medicaid pay for the same services? So those kind of practical things we have to discuss. But I think the other part of climate change, which I think needs to be paid attention to, is heat waves are getting more intense and longer. Cold snaps are getting more intense and longer. People with disabilities, how do they then access their community when that is happening? Is the staff going to be able to get to them? In one of the upstate localities, they actually, during cold snaps, allowed buses to run free so that the staff do not have to think about how do they get to the place where they need to.
Free buses? Did we hear?
Yeah, I know.
About free bus service?
On a side note, I was at a forum in New Jersey, and one of the things, and one of the presenters was from MSNBC talking about, New York City and titans of Wall Street, et cetera. And I did ask her, how is it at this time that somebody who got elected to be a mayor speaks about buses being free, and there's an uproar from New York City Wall Street titans, but at the same month, another person who's supported by Wall Street gets $1 trillion pay package. I don't understand this at all. There's got to be something wrong with the government. But anyway, I digress. It's a political statement.
Quite right. That's quite right.
So I think climate change, we have to think about not just the emergency disasters which happen, but also the impacts of climate change on people with mental health needs, because they also are on many medications which are exacerbated by heat. And that then shows up in the community in many different ways. So those are the conversations we need to be having on climate change.
Thank you.
I think for the Asian American community, the biggest issue that we see is actually around language access when there is an emergency, right? So making sure, the Asian American Federation, one of the things that we really fought for was this thing called Local Law 30, which requires that essential government services be translated into language. And we are part of an effort that the AG's office is leading right now because the Federal Communications Commission is delaying the creation of emergency alerts into language. So if there is a flood, if there is a hurricane, if there is a whatever going on, flash flood like a couple weeks ago, those alerts are not actually happening in language for folks right now. And so it's just yet another place where community organizations end up needing to be that bridge, that last mile, to make sure that our communities actually understand what's going on and do that translation ourselves.
Well, with respect to climate, and we heard a little bit earlier about narrative, and I think sometimes we hear that and you think about changing the language or how something is talked about. But a lot of it, at least the way we think about it, is correlation. And so there's a strong correlation between climate and extreme weather and health and economic outcomes. And so, for example, you may have read about this in the New York Times recently, women who are working outside in India are suffering greatly because of extreme weather and the conditions that they have to work in. A couple of years ago at the Clinton Global Initiative, a number of organizations got together to launch a commitment, and as I was saying earlier, the action-oriented aspect of CGI is called a commitment to action, which are usually new plans or partnerships to address a problem. They started an organization called the Self-Employed Women's Association to be a collective to be able to purchase insurance for women who are self-employed but are working in extreme conditions because they're often missing work because of extreme weather, because of the conditions, and that is having a negative impact on their economic situation, that of their family, and all of the correlated things. So that's one thing we'd like to talk about, the correlation between things. You mentioned the challenges with the FCC right now. There's another correlation, not necessarily global health, but we all know the federal government took funding away from public media, NPR and PBS. Well, most people don't know that NPR also funds or is a big piece of the emergency broadcast system. And so when you're taking money away from the system, you're now making it harder for people to get the information that they need to survive a crisis, to go through their day to understand where they can get help, and that an emergency is coming. Some of those emergencies are climate related. So if you don't know a tornado is coming, you can't protect yourself from it. So these are all correlated, and that's just some of the ways we're trying to address it through CGI.
Dr. Vassan, you had?
Well, I think climate and health is one of those, it is a real embodiment of the public nonprofit partnership in this city. We established a climate and health program in the last couple of years, built off of a number of programs that have been around for many years that require nonprofits to really be going into communities and mitigating the risks of extreme weather. That's how climate shows up in cities, right? Is extreme weather. Around 350 people die each summer from extreme heat. We always have deaths from extreme flooding in low-lying buildings. Increasingly, and as I learned the hard way, air quality events can happen with the snap of a finger and with increasing frequency, and while not necessarily fatal, at least at scale, cause a great deal of distress and can even shut down parts of the city. And so one example of a fantastic public-private partnership is a program called Be a Buddy. We know from the 1994 Chicago heat wave and the research done by folks like Eric Kleinenberg around that history, that the people who were most vulnerable to death and bad outcome on an extreme hot day were the elderly and socially isolated. And so what did we do? We partnered with a host of small local nonprofits, the same ones that are going to be under threat from these federal cuts trickling down, to simply pair a vulnerable older person or a socially isolated person, some of whom have serious mental illness, with a worker, with a community health worker who can knock on their door, particularly, and check on them in times of extreme heat, and bring them to one of the cooling centers that the city sets up, or even bring them to another apartment that has air conditioning. And so these are the kinds of granular programs that we're all gonna, some of what we see will be very visible in these cuts, and we will be able to marshal a huge outcry around them, whether it's crisis services or overdose response or basic healthcare cuts. And there will be a lot made of the basic healthcare cuts to Medicaid, but there's going to be a lot that happens in silence that we hardly see, but that people feel every single day, because these aren't huge multi-million-dollar programs, but they are the lifeblood for the most vulnerable people. And that's what scares me the most, is that there will be a flurry and there will be an outcry. And I know you will all organize against the big picture, but how do we also lift up the smaller picture of people who are deeply vulnerable and whose programs that they depend on are really on a knife's edge, and these federal cuts, even if they aren't directly impacting that program, those will be the first programs on the chopping block when it comes to, do I reinvest back into Medicaid or into a core healthcare service, or do I protect these most vulnerable, isolated New Yorkers? Why do we have to make those choices? And that's the position we're being put in.
Now, we're going to do a couple of quick things. Catherine, I want you to get back to your slides and be able to talk through a little more about what you do, and then we'll do a quick sort of lightning round. This is going to be a call to action. So what advice would you give for everybody, what advice would you give to our students, our nonprofit leaders, our community leaders that are here about how to think about the path forward? As we're doing that, there was a QR code up there. If you have questions, we're going to do this new thing today. If you have questions, do you take photos of a QR code? Is that what you do? You take photos of the QR code, and that question, type in your question, that question will show up on my phone. Very cool thing. And I'm going to find a way to make sure I find your question on my phone, and we'll get to one or two of them before we ask our panel to wrap up. But why don't you continue, Catherine, as these questions come in?
And I'm sorry to the person who's driving AV. Don't worry,
yes,
don't worry about putting the slides back up. I'm just going to talk really quickly because I think something that Dr. Vassan said is helping to frame this conversation also, right? I feel like we cannot have a conversation about what is happening in terms of federal health policy without having a conversation about what is happening with immigration. And in our community, I would say that the number one driver of behavior right now and of the mental health crisis is the way that immigration is being enforced. So for us, we have seen 1,000% increase in the number of arrests and deportations of Chinese and Bangladeshi communities here in New York. 1,000% increase. We are seeing communities who are adapting the best way that they know how in an environment where the government is intending to confuse and to scare and to traumatize and to be cruel as much as humanly possible. And so the natural outgrowth of that is that our communities are not putting their kids in school, are not going to the doctor, are not accessing food the way that they need to. And I think the long-term policy piece of this is when we are looking at how effective is a program, how well did they do at reaching a community that is vulnerable, how are we thinking about the fact that there is a suppression of participation in a lot of these programs because people are terrified? Not only that, but I do want to also just flag, suicide is a leading cause of death in the Asian community, right? Among 18 to 22-year-olds, it's the number one leading cause of death among Asians. The Asian women over the age of 65, number one, most likely to commit suicide in terms of the national population. When you add to that, you fled, most likely, a war or a crisis situation in order to come to the United States in the first place, in order to give your children the possibility of a better future. And now, not only are you here and trying to survive, the rules are now changing in front of you, right? Most of these folks came here legally, and the rules are changing in the middle of the game for them. Whether that is temporary protective status that has been removed from Nepali or Afghan refugees who came here because of crisis, because of climate change, because of war, all of these things that have led people to coming here legally. And then all of a sudden, the administration has made the decision that those rules are going to change and that in whatever the middle of your process was, you now aren't supposed to be here any longer. 2 days ago, the administration announced a proposed rule change to public charge, which suggests that if you have ever used benefits, even when you were allowed to use public benefits, that should actually determine whether or not you are allowed to stay in the United States and have a pathway to being here legally, right? That wasn't the rule 3 days ago. And we have a 30-day period, so this one minor call to action, those of you who work in organizations that work on immigration or who work on healthcare, which I assume is many of you, get your organizations to be submitting comments into the public comment period to make sure that this rule doesn't happen. But for our community right now, when we are talking about access to services, when we are talking about whether or not the health systems and the policy systems are responsive to us, we can't have that conversation without the conversation about immigration. So I just want to make sure we bring that into it.
That's extraordinary. Thank you for raising that. We're going to do a bit of a lightning round, and I'm going to use the questions from the audience. So any or all of you can answer, but as short as we can. One question, it's a great one. The nonprofit sector is very broad, but the work that organizations tend to do overlap. But unfortunately, funding is scarce and competitive. How can foundations help guide nonprofits in silo bringing and increase capacity? So I guess, should we be talking more collaboration and mergers among nonprofits? How are you all thinking about that?
Well, from our standpoint, we are seeing a lot more collaboration, and we are seeing ideas and terms that are more typical of the private sector coming into the fold. Another CGI commitment is called the African Venture Philanthropy Alliance, and they are pooling money to improve mental health outcomes in Africa. There's another organization called Every Cure. That's another CGI commitment. They are tackling rare disease. There's a place where you're seeing a lot of innovation. Rare disease, obviously, there are so many of them. Collectively, it is a massive issue. But Dr. David Fagenbaum, who started the organization, realized that a lot of those rare diseases can actually be treated by drugs that are already available. So he's using AI to identify where those drugs could be applicable and then try to speed approval. And he's gotten a massive response, and it's a really groundbreaking idea. So there are bright spots, but I think collaboration really is key, and that's how foundations are thinking about it.
Okay.
I would just add, so I've worked in foundation and now obviously been running nonprofits for the last number of years, but if the question is coming from someone who's in philanthropy, then the thing that I would say is when you are thinking about how to judge whether a proposal is worth supporting or not, put into the requirements ahead of time that you're looking for how they are partnering. Don't do the matchmaking yourself. I think many foundations try to say, like, I know this group and this group do the same thing, and I'm going to, as the funder, decide that you guys should work together. That never works because the relationships either exist on the ground naturally and already, or they don't. And it is not always the funder to sort of drive that.
I mean, philanthropy could be much more ambitious about the way it even structures grants. There's no reason the grants need to be as siloed as they are. Yes, financial management is easier when you can put one grant to one project to one organization. But if anyone can do it differently and do collaborative grant making, collaborative fiscal monitoring, collaborative performance management, it's philanthropy. So go back to first principles if you're in philanthropy and start to say, wait a minute, maybe we should be putting out team-based grants. And maybe we should be looking at across the spectrum of services, say for people with mental illness or people or maternal and child health. Who are the organizations working at different points in the continuum of care, and how do I fund them collaboratively rather than saying, well, I'm going to put this call on this narrow slice of it and then fund 3 organizations in that space. And then you reinforce the competitive habits of nonprofits at a time when we can't afford that. I think the underlying question, though, Basil, is this. I always have this real issue with the big versus small debate. The smallness and the proximity and the history of organizations rooted in places often overlooked is their competitive superpower. It is their competitive advantage, but it comes with deficits in administration, in reporting, in data. And so that's the other place where philanthropy can do better. Why expect each of those small organizations to transform their identity through merger and acquisition or through some superstructure? Build the superstructure for them. A good example is the Medicaid waiver that we have in the state. What did we do? We built social care networks in each of the boroughs, which are essentially fiscal intermediaries, operational intermediaries, training and education intermediaries. But the money, the goal of the money, is to get it out the door and into community organizations closest to the problem that have the big T word, trust, which is kind of underlying a lot of what we're talking about today. So philanthropy can be catalytic here. They've done it before. We saw it during the Obama administration, philanthropy leading the way on new ideas like opportunity zones and challenge grants. We can do it again, but I am yet to see a lot of bravery in the philanthropic space, and we need you. We need you to be brave.
Is there a related question? I'm sorry, Rob.
I think I just wanted to pick up on what the 1115 waiver and the condition that's set up. I think there are some very promising signs. I mean, in working in the intellectual disability space, we are not able to participate in that as much. But one of the things which we've been finding as we work with families in crisis and their children and adults is, many a time if their children or an adult with an intellectual disability is in crisis, which is when we start engaging, which is what we are funded for, we typically realize the family is in crisis. And typically those families have 3 or 4 different systems engaging with them, funded by different bureaucracies. And if the family is in crisis, how many case managers are they dealing with? 4 or 5.
Right.
You need a super case manager sitting on top to be managing those case managers there. And the family is in crisis. That is not a system which is set up efficiently. How can government, and maybe the 1115 waiver is a sign it can be done, but how do we take that away and make some of those funding streams be less siloed, which will then force organizations to maybe work together so that they can bring the best outcome to keep the family together. And I think it's just not the foundations, but I think the way government is thinking about having these very siloed bureaucratic systems.
Okay. Two quick questions. One, and then we'll wrap there. The one specific for you, Catherine, what's the name of the app used that your organization uses to help health education translation?
Say that one more time.
The app, the name of the app that you use to help health education translation. Or is there
I don't think there's an app. We are in the middle of standing up the first ever Asian language worker co-op for translators. So that's happening for the first time ever in the country. And those translators will be able to accompany healthcare workers and lawyers to make sure that there's access. But there's, and if I'm misunderstanding the question, somebody come and find me. Whoever asked that question, come and find me after.
Okay. And lastly, before I ask for your call to action, I'll summarize this. How do you see the evidence-first trend affecting the space for innovation, and what are funders doing to ensure it doesn't crowd out new equity-driven ideas that don't yet have a long track record of proof?
Evidence-first trend, is that what?
Evidence-first. How do you see this evidence-first trend? Oh, let me actually start over. There was a mention about big philanthropies increasing investing in proven health interventions. Innovation, especially from diverse and underrepresented communities, often starts as unproven and higher risk. How do you see this evidence-first trend affecting the space for innovation?
I think it gets back to what I said in my remarks. During COVID, we had very rapid, risk-tolerant, responsive philanthropy. I mean, people put money out the door, often without any reporting requirements or minimal reporting requirements, and they did so because it was a crisis. This is no less of a crisis. It's just going to have long-term effects, and it's a structural crisis in a way that, you know, COVID was to a degree, but it was also punctuated by the emergency of now. This is a slow-burning emergency that's going to last for years to come. So I think that's a false choice. I think you can get money out the door to the places that need it, to the organizations that are trusted, that are closest to the problem. You can also fund the large philanthropies as well. There's plenty of money to go around. The scarcity mindset now ain't gonna work, right? We have to push past this scarcity mindset. I mean, I was talking to Craig about this. Everything good that we've done in global health was because we had the ambition to say, like, I don't accept that as an outcome. Why can we marshal that kind of, that freedom from scarcity when it comes to treating HIV in developing countries, but we can't do so when protecting immigrant rights or providing health care to Americans, to low-income communities across this city, this state, and this country? I don't get it.
Right. Thank you. Yeah.
Can I just add one thing I love this question. I think one of the things that is very challenging, and it might be a little spicy to say this in this room, but it is the corporatization of the nonprofit sector. And part of the challenge that I see is we do not put enough currency in the trust, exactly what Dr. Vassan is saying, that last mile trust that local organizations have. So the example I would give you is we run a mental health roundtable. We've done it for 10 years. It is non-clinical, it's psychosocial, evidence-driven, but we don't have the numbers to put into JAMA or whatever that tell you that Tai Chi is good for Asian elders and their mental health. But we know it because it's generations of knowledge that tell us that that is true, right? So I think that challenge of being able to say, how do I quantify something other than the evidence you're looking for? How do I quantify trust? How do I quantify access? How do I quantify speed of uptake of something as a way to scratch that evidence itch? it really does require us to all think a little differently about how we define success, and also for funders to be willing to say, like, how you define success and how I define success, they're different. They're not, one is not necessarily better than the other, and we have to find a way to actually be able to make that speak to each other.
Yeah, it's interesting because when I did, oh, you could clap for that, I understand. When we did this symposium a year ago, it was right after the election, and we had essentially a nonprofit town hall, and somebody used a term, which I never forget, decolonizing philanthropy, and I thought that was a remarkable term. I just want to end on a call to action. You know, tell what can everybody in the room go outside of this room and do to affect the change that we've been talking about here?
Well, I, in some respect, you're doing it, and I think the fact that you are interested in this line of work can feel daunting because the challenges are daunting. But as we've heard today, the space is actually going to continue to be more important, and innovation will come. I just want to say I don't necessarily think that proven solutions are antithetical to innovation. I think often it's how you use those proven solutions, and hopefully, we do know that many funders are looking at how they make grants and other things to do it better, and I hope that continues. What you can do, you can educate your friends, your neighbors. You can use your own platforms. You know, there's always been, I think, or just not. I think, you know, President Clinton talks about this all the time. You know, the nonprofit sector still, in any given year, is about 10% of the U.S. workforce, but it's probably the most misunderstood sector. And as he talks about, you know, the first philanthropy organized in America was a volunteer firehouse in Philadelphia. So the fact that it is so much part of our lives in so many different ways, like we heard about here today, is something people don't understand. So I think one thing everybody can do is help connect the dots better, and you know, improve the narrative and make people feel good about how many people are devoted to making the sector work for everyone and continue to do it.
Thank you.
I would say, I think for each of you who are doing this work, invest in and practice your own personal resilience. We are in a wild time. Burnout in the nonprofit sector is a real thing. And oftentimes what I see now in my second stint as CEO of nonprofit is that by the time you get into this seat, you are exhausted, you have your own mental health needs, you have your own challenges, and if you don't practice now, finding boundary, finding resilience, being able to get up every day and not be overwhelmed by the news, even though we are all overwhelmed by the news, but the practice of resilience, that is going to actually bring us so much further, so much faster, and so much more in a sustained way as we have to rebuild and recreate what the sector looks like.
Thank you, Catherine. Robbie?
You know, I just came back from doing a leadership forum with our employees in California, and we are all across California, and we work with some of the most, what we call the safety net services. If we weren't doing that work across the state of California, those folks would all be in institutions, not being able to go out in the community. The same challenges around workforce, the same challenges around funding exist, and they deal with it every day, dealing with different police departments, dealing with different regulatory bodies who are breathing down their necks, staff who are themselves traumatized, working with many of the folks we are working with who have incurred trauma. And many a time it is very difficult to get your head out of the sand and just not feel overwhelmed, as Catherine was described. How do you find the resilience? It is at those times, I think it is very important to think about how somebody impacted the life of Charlie, who's a 12-year-old child who had been kicked out of multiple schools, and the work we did with Charlie, now he's a peacemaker in that school. We gave him his childhood back. If those kind of stories don't inspire you, I don't think this work is cut out for you, because it's very easy to think about the populations and the challenges which exist. And the one thing I can say is, I've been doing this work for over 30 years. At what time have nonprofits been not challenged? I don't remember a time. It's always been a workforce challenge. It's always been a funding challenge. I think the news just exacerbates things right now, but it's always been. And if you are history aficionados, think about all those times going 200, 300 years back when people were treated with such inhumanity. So think about what you do as an impact to kids like Charlie, and that's how you realize why you do this work.
Thank you. Doctor.
That's a tough one to follow, and I think inspirational for the reasons we all have done and are doing nonprofit work. I would, one of the things I learned in government is that the power of convening is actually quite important. And often I heard this many times actually, when I did convene a group of nonprofit organizations and leaders. I did a big roundtable on API mental health towards the end of my tenure. Their answer was, it was remarkable how many of them said, this is the first time we've ever been brought together, or this is the first time we've been in a room together, or we convened all the providers of serious mental illness services in the city at one point, and they said, we've never done this before. I've been doing this 30 years, 40 years. Don't wait around for government to convene you. Convene yourselves now. Catalog the impact now. Philanthropy, create the space and the funding to convene now, because we will need to tell the story of the loss and the impact as a collective. We need the stories of the Charlies to sustain us as human beings. We need the stories of the collective impact to push back with some power and some might. And it's the combination of those stories, the personal and the population, that will convince elected leaders, appointed leaders, to start to pay attention. It is possible, and I'm going to say a political thing, pay attention to what's happened with this Epstein nonsense. How did it start? Groups of victims, groups of women, not telling their own individual stories, which were tragic and painful and hard to hear, but coming together, getting in front of the right elected officials, convincing them to change their minds, to break ranks, to break coalitions. This fever is breaking. We can break it further by telling the stories of the everyday impact that it's having in our communities. And so I thank you for all the work that you're doing every single day, but just know you're not alone in it.
That is, thank you. That's partly also a pitch for the class that I teach in narrative and storytelling here in the School of Professional Studies. So thank you all very much. To this panel, so grateful for for the work that you do and your attendance here today. Again, thank you so much for your ongoing friendship.